Good afternoon and welcome to the FEMA Region 2 Individual and Community Preparedness webinar series. My name is Allison Albright and I'm the Regional Preparedness Liaison for FEMA Region 2. I'm going to provide a few technical considerations before we begin. Today's proceedings are being recorded and captioned, and the archived event will be available on the Region 2 website in the coming days. You should hear audio through your computer speakers, so please ensure your volume is turned up so you may hear the proceedings accordingly. In the top right corner, we ask if you'd like to receive news and updates from Region 2, and if so, please enter your email address and we'll be able to add you to our distribution list. We will have a question and answer session after the presentation concludes. You'll see a Q&A pod in the lower right-hand corner. Please feel free to submit your questions about the subject matter there, and time permitting, we'll do our best to answer them. Finally, the PowerPoint presentation from today will be available for you to download in the file share pod at the end of the presentation as a PDF. You can click on the file and download it using the download button. With that, I'd like to turn it over to Debbie Costa, Preparedness Specialist with Region 2, to introduce our speaker and today's proceedings.
Well, it helps if I take my phone off of mute. Good afternoon, everyone. I am Debbie Costa, the Preparedness Liaison on the New Jersey FEMA Integration Team. On behalf of our team working to strengthen preparedness across New York, New Jersey, Puerto Rico, and the Virgin Islands, I'm thrilled to welcome you to our monthly Preparedness and Resilience webinar. As part of FEMA's 2018 to 2022 strategic plan, our goal one is to build a culture of preparedness. Our division is focused on helping people prepare for disasters, which includes helping individuals and families be better prepared and building more resilient communities. As part of that goal, we're pleased to be hosting this webinar on stress management related to isolation, social distancing, and quarantine. Social distancing, while necessary to slow the spread of COVID-19, can have a significant impact on mental health. Curtis Barnes from AmeriCares will be providing resources and information on how to manage this stress. Curtis Barnes completed his bachelor's degree in psychology from the University of Maryland and his master's degree in mental health counseling from Bowie State University. He was honorably discharged from the U.S. Marine Corps and U.S. Army after serving his country for 10 years. Curtis is licensed as a professional counselor in Maryland and Texas with 5 years of counseling experience across a variety of treatment settings, including military, private practice, inpatient substance abuse, and community-based services. He has been a member of the mental health and psychosocial support team of the AmeriCares Hurricane Harvey Recovery Program in Texas for the past 2.5 years. During his employment with AmeriCares, Curtis has deployed to Florida to assist with emergency response efforts following Hurricane Michael, and to the Bahamas to provide MHPSS support following Hurricane Dorian. Curtis, I'll turn the speaker over to you.
Thank you, Debbie. So let's get started. So today's webinar, we will be talking about managing the stress of social distancing, isolation, and quarantine. So infectious disease outbreaks are one of the most distressing forms of disaster, especially trying to deal with it psychologically. With more than typical disasters, we know for sure that whether we have been personally impacted as well as physically impacted. However, because of this COVID-19, we don't know when it ends, whether we will be affected or whether our family members may be affected. So this is one of the reasons why we are doing these webinars, to identify some of our stresses while we are shut in. Okay? So the first thing we want to do is discuss Alice. Okay? Alice is a 36-year-old woman who has been working from home for the past 2 weeks since her community was placed on shutdown. Each week, Alice stays busy as she must attend virtual meetings and phone calls as part of her job. On weekends, she feels a lot of anxiety and wants to go out. She wants to hang out with her friends. She wants to socialize. However, because of social distancing, she feels isolated. lonely, and bored, wondering how long it will be before this craziness ends. Quick question to the group, and you can place it in your chat box. What might you suggest to Alex? I'll give you a few seconds. You can give me a couple of suggestions. Zoom hangout sessions, yes. Call friends. Write letters. Thank you. Exercise. Thank you. Those are great suggestions. Perfect. Thank you. So for this webinar, we are going to identify certain things. One, I feel that it's very important to separate or make distinctions between isolation, social distancing, quarantine, curfew, and lockdown. Also, I want to help you guys identify emotional reactions and stressors during and after these periods. I want you guys to know the importance of communication and connections with others during this period, as well as recommended activities for children and adults. So I know we've been inundated with information regarding COVID-19 and how infectious it is. We're going to just identify some of the signs and symptoms of COVID-19. So you may find yourself with a dry cough, high temperature, or difficulty breathing, along with shaking chills, headache, muscle pain, vomiting, and abdominal pain. So if those things or those you feel this way, you might want to speak to your physician or follow the protocol of your local area. And because this disease is so contagious, the government has asked that we limit physical contact and requested us to stay in place, whether it be at your home or with your family or friends. And the reason why is it's a preventative measure. It helps reduce the spread of this infectious disease. So they're asking us to limit our time in open spaces, limit our time in crowds, so one of the recommendations from the CDC, as we've been saying, is social distancing. Well, social distancing or physical distancing is a set of non-pharmacological interventions or measures taken to prevent the spread of a contagious disease by maintaining a physical distance between people and reducing the number of times people come into close contact with each other. So it is recommended that if you are out, that you maintain the distance of at least 6 feet or 2 arm lengths away from others, or try to avoid gathering together in large groups. Why? We want to reduce the probability of an infected person, an uninfected person, contacting or being infected by another person. So with that, it limits us from going to school, going to a sporting event, also socializing outside of home, whether it be the movies, bars, and traveling. Next, we will have curfew. Well, in certain places, in certain states, the span of time in which you are allowed to be outside your home varies. However, most would say from 6 a.m. to 11 p.m. you have the ability to, especially for essential workers, to go to and from work, get your essential needs, whether it be grocery shopping, getting gas, and things like that. However, if you are out past 11 o'clock or out past your curfew time, you may be subject to either tickets or arrest So it just really depends on your area. And in extreme measures, lockdown. It's an emergency protocol that usually prevents a large group of people from mingling or being out at one point in time. And it also helps decrease the spread of this disease. Next, we have quarantine. Quarantine is used to keep someone who might have been exposed to COVID-19 away from others. We know from the news earlier in March, the Queen Mary that came from Japan to San Francisco, or Travis Air Force Base. So that whole cruise line was quarantined, meaning that all those who were on board could not leave until they passed their physical exam. And so the CDC recommends that if you are quarantined, that you respect the mandates of staying in place for at least 14 days and also monitoring your symptoms and following directions from your state or local health department. Isolation. Although just like Alicia said earlier, that we read in the earlier slide, that she felt like isolated. She felt isolated and bored. However, in this context, in a healthcare facility, isolation means something totally different. One, it prevents the spread of the infections to others. So you may find that extra protocols may be in place. When you make contact with someone who's infected, you may have to wear gloves, gowns, face shields, and masks, and also separate your client or patient from others in a special place or special wing. So why are these measures being taken? As we said before, it slows down the contagiousness of this disease. It ensures that medical treatment is available to those who really need it. So in an event that an infectious disease outbreak, local officials will use these measures to enforce or to stop or decrease this disease from spreading to others. So we've spoken about social distancing, isolation and quarantine, curfew, also lockdown. Can someone quickly define what flattening the curve means? And you can use that in your chat box. What you think flattening the curve means to you? We have stretching out the pain, steady pace, getting out of danger, maximizing the spread, spreading out the use of the hospital resources. I like to take that, yes. It's the attempt to try to spread out hospital resources. Most health facilities or systems have only a limited amount of inventory, whether it be emergency services, inpatient beds, ICU beds, ventilators, healthcare professionals, nurses, or physicians, and also just space in general. So if everyone was infected at one time and everyone went to the hospital, then it will stretch the capacity of the hospital system. So in order to spread this curve out, or to keep or strengthen, to increase our effectiveness, we ask that people social distance themselves and isolate themselves if they have come in contact with others. something that's an important fact is that we all experience this disaster differently. And we are capable of being isolated. Some of us do not, really like to talk or speak to others. And then there are those who really need that social support. And so we must be mindful of those things. Also, to be mindful that those with pre-existing mental health problems are much more vulnerable to experiencing negative psychological effects during and after this quarantine. So common stress reactions, right? How do you know when you're stressed out? If you can put a couple of those answers in the chat box, how do you know when you're stressed out? Yes, lack of motivation, headaches, rapid heartbeat, depression, trouble sleeping, insomnia. Yes, irritability. Yes, some have pointed out that in the chat box that the physical reaction. So the physical reaction to stress, we all experience it differently. At times we may find ourselves with an increased heartbeat. Blood pressure has increased. Also, our palms get really sweaty, our head, we start getting really tense in our shoulders, which may increase or help or increase our headache or the pain of our headache. Overeating or not eating. Yes. Yes. That's correct. Yes. Thank you. Also, think about those times that when you, since March, have you also thought about why I can't sleep? Why do I feel this way? Why is my heart beating this way? This is your stress reaction. Early on, as we used to call the triune brain. So the amygdala sends out these hormones, the cortisol and the adrenaline when we are stressed or when we are in our fight or flight mode. And so we do have these physical reactions or responses to stress or danger. And when we do that, our body exerts more energy. So especially if we're not eating enough, we are burning too much. We have issues, whether it be with sleeping or just lack of energy or motivation to do some of our basic tasks. Okay. And emotional reactions. What are some of your emotional reactions? I believe someone said that they may get angry or sad or depressed and anxious. So what else are some of your reactions to? I see intense drinking and alcohol, smoking. Those are more the behavior aspects, yes. So symptoms of depression and hopelessness, you may find yourself change in appetite and insomnia or hyposomnia. And you may end up having symptoms of post-traumatic stress disorder, intrusive thought, reliving these events like flashbacks, nightmares, and change in thinking. So that last bullet here is something to be aware of, and a client, yourself, or those who you're working with, you may have to recommend or refer them to a higher level of care if they are having these symptoms. This, I've read here, behavior reactions. We may feel like we may eat a whole lot more. We may have difficulty sleeping. As we said, we have change in appetite. We may, I know early on, I really wanted to watch as many Netflix shows as I could. However, after a month, I don't know whether it was the lack of shows on Netflix or just my motivation to watch Netflix. So those things change. Things that you thought were really fun to do, you may find mundane. So your motivation of doing things or exercising may decrease. So be mindful of those things. Look for signs and symptoms. cognitive reactions, feeling distracted and then unable to focus on anything very well or very long. You may find yourself thinking about the outbreak even when you are trying to focus on other things. You may be feeling disoriented and as you're losing track of time. So think about those things. When you feel distracted when you're trying to do work or when you're trying to complete a task, you may find yourself thinking about, as it says here, the outbreak or what it may mean to you and your family, some of the stresses that you may have or thoughts or ideas about finances, right, or health of your loved one. So that increases the likelihood that you will have issues with your concentration. Spiritual reactions. Oftentimes after a disaster, many will say or ask or question their higher power. What does this mean? Why does this happen to me all the time? Can you help me out? We may pray a little bit more. So these stress reactions, we may start questioning our beliefs and our spiritual higher power. So think about that, and also try to address those things. And as we said before, social reactions. When we're stressed out, how often do we get along with others? And especially if we've been away in our homes for 3 months. We may be aggressive towards others. Conflicts may arise, whether it be in your home or at work or at the grocery mart. Conflicts do arise when you're really stressed. Or you may withdraw. You may find yourself not wanting to do anything outside of the house. You may not want to come out of your room when you're home. You may not want to have dinner with your family. So some of the stress reaction may be withdrawal. It may increase conflict, and you may become more aggressive. As we said before, arising stress after these periods. Finance is very important to us all. So the stigma, the rejection in the community, sometimes we may want to avoid going out because of the thought that you may have COVID-19. I know the stresses of just being out in public and not wanting to sneeze or cough or anything like that. That can be a stressor. Also, the unemployment rate is skyrocketing. So that is a stressor to be aware of. So after we have identified some of the common stress reactions, we want to make sure that we are able to communicate these things. So we need to try to keep in touch with our loved ones, not just to check on them, but to also make sure that they have, or you have an accountability partner. Especially within this day and age, we have the use of phone, email, text message, social media, all of these things, FaceTime, and Skype and Zoom. So it is important that we increase our communication with our loved ones so that we are held accountable and that we're okay, and also you're checking on your loved one. So what are some of the coping strategies to support well-being? What is it that you've learned so far being isolated now that has worked best for your well-being? Question to the group. Walking, yoga, yes. Not watching CNN, yes. Prayer, reflection, yes. Guitar, mediate. Walking, yes. Working out. Journaling, yes. So let's talk about psychological wellness. It's important for our well-being, our whole self, that we identify and break out some of our issues. And so we will start with psychological wellness. So that's how we will start working, would be to increase our awareness. So to sit with ourselves and to understand and feel what it is that we are going through at that present moment. So if we are heading out to the grocery mart, what are you feeling? Or if we're about to go to work, what are you feeling? Or what are you thinking? To be aware of those, to acknowledge those things, and to confront those things. Also to be adaptable, to be flexible. Some 4 months ago, we had our routine set, whether it be get up and go to work, come back, have dinner, watch TV, go to bed, do it over again. However, now that we are in the middle of this pandemic, our work schedule has changed, our eating habits have changed, our relationships have changed, so our expectations should also change. So to be a little bit more lenient with ourselves and knowing that that in order to survive, we have to, at times, cut back on things, whether it be waking up. You may need an extra hour to sleep, or whether it be for your kids to go to bed. Used to go to bed at 9 o'clock. Now they may stay up to 10 o'clock. So being adaptable and knowing that we're not Superman and we have to reserve and endure too. So decision making. After we've increased our awareness of how we feel and what's going on internally as well as external, we try to come up with a plan, decision making, and problem solving. So we have identified the problem, we set a plan, and now we need to make sure we are mentally ready to enact this plan. So positive thinking is very, very important. Physical wellness is that I saw in the chat box. We've some have created this routine of working out a little bit more. And as we know, stress can affect the body, can affect our immune system, our blood pressure, can increase the probability of diabetes. So we need to make sure that we recover by eating well, getting a proper rest, also by getting enough sleep. And what should we do to increase our endurance? We work out. We try to be as active as we can. Also, we want to make sure that we prepare ourselves. And as we said before, mentally, we make sure that we are eating proper food. Not just that we're eating a lot more or a little less, but we're eating proper food, getting our protein, strength. So we need to increase those things. We need to increase our activity so that we can be much more effective in the workplace or in and around home. So we want to increase our strength. So identify those things and to work on those things. Social wellness. So increasing our communication, trying to spend less time with our work communication and more with our loved ones and family and friends. Communication, as we said, is not just about sending a text or email. We can also write letters. And try to increase our connectedness. I know I've incorporated now, I can't say I used to do as often, have dinner with family after 6 o'clock. So now we've had this routine of eating dinner together all the time. And so that is something that you can engage in also, so to increase your connectedness with your family. And social support, know that you do have friends and family that care for you and that's willing to help and assist you. So it requires teamwork. Teamwork could be just as for myself, doing webinars, I have a co-host or a co-facilitator and also a technical support or a technical advisor. So knowing that we're not alone and knowing and engaging others to assist us is very important to our social wellness. Also learning about the resources in and around our community can increase our social wellness. Spiritual wellness. At this time, we do find ourselves having moments where we are questioning everything. We're questioning our job, questioning our health, questioning our finance, our relationships. So taking a minute to sit back and writing down your core values. What is important to you? What is important to you? And also, as we said, try to come up with a plan. And try to persevere. What is your purpose? Try to find that purpose in whether it be your job, whether it be your relationships. What is it you hope? What is it you hope for? What is it you're looking for? Some recommended activities. So we will introduce, just bring in shortly, children in periods of social distancing and quarantine. Sometimes children revert back to their earlier stages. When they're fearful, they may end up changing their sleeping habits or eating patterns. They may end up having tantrums, forgetting tasks and new information. Physical symptoms. They may say, either my stomach or my tummy hurts, or I have butterflies in my tummy, or I have headaches also. And what I mean by revert back to earlier stages, you can see or find those things in language, where you may have a teenager referring to you as mommy, papi, or may revert back to wetting the bed. So be aware of those. But one of the things that we want to increase is activities for activities or a daily routine. Try to find as close to as normal the routine that you had set earlier. So whether you eat dinner at 6, I know things have changed and we have to be much more flexible. Try to get back to having dinner at least once or twice a week, or push back your time for dinner, or bedtime, television time. So try to set and create a daily routine. Physical activity. So we want to engage and we want to have them to exert some of that energy or pent up energy. So you may engage or have them work out with you, do some exercises with you, or go work out in the yard, or have them help you with dinner, setting the table, things such as that. Try to spend at least 30 minutes to 1 hour without electronics. I know that may be difficult for others, but yes, we want to try to have them to step back a little bit and try to decrease their use in electronics, and also increase the use of board games and puzzles. As for adults, what is something new that you have done since this pandemic? And that's a question to the group. Something new you've learned. Gardening, yes. Practicing piano. Yes. Coloring, puzzling, reading more, baking bread, virtual game night, reading a book, more technology, reconnecting as a family, puzzles, reading, yes. Thank you. Thank you for sharing. Yes. So we have here some list of activities that that we recommend. home remodeling, and I believe someone just said gardening and cleaning or painting a room can relieve stress. Try to make sure that you get your rest. Try to make sure that you are trying to be in bed at a normal time. You may find yourself trying to organize your closet or drawers. Try to meditate or learn how to meditate. As we said here before, exercise, table games, Monopoly I love, yes, yoga. Also, try to take a course online. Try to learn something new. We can relax our body by doing a deep breathing and stretching. Talk about your experiences and feelings to others, to your loved ones. And as we said before, thinking positive and keeping hope. So in conclusion, always remember to stay calm, get informed with a reliable source, follow the instructions that are provided by your local government, and to continue practicing universal hygiene. If you have any questions or extra resources here in the back slide, I'm open for questions. Thank you.
Thank you so much. That was a lot of really good information. If anybody has questions, please add them in the Q&A pod below. Curtis, we did have one question come in for you asking, how can you intervene with friends and neighbors who are obviously overstressed, without being nosy or prying?
Just one, not to really, as this person stated, not to be nosy or anything like that, but you can just tell them what you are seeing. I'm noticing that you seem a little bit more stressed than usual, or you seem a little bit more agitated. So you want to increase that contact and hope that they would communicate. But you don't want to press them to speak, but you always want to let them know that you are there and present to provide them assistance. If there are signs that their stress has increased to where they may harm themselves or others, then that's when you may have to take a different approach. But I always will just reflect back to this person what you're seeing, and to let them know that you're aware and that you're there to provide some assistance if ever that they need. Thank you for the question.
That's good advice. So I think, the resources that you have on the screen kind of point to being informed is a good way of reducing stress, and having reliable information about the situation, and maybe not relying so much on social media that may or may not be accurate, has a lot to do with someone's ability to manage their stress. Would you agree?
I do agree. And those are some of the harder things, but as we said before, to be aware of those things that do create or exacerbate our stress by not watching too much TV or watching too much news, making sure that we have the proper information, as you stated before, about, let's say, contact engagement, whether I need to wear a mask or gloves to the grocery mart, or whether I can be outside of the house past 11 o'clock. So being aware of some of the rules and regulations, and also being aware of our internal reactions to stress can reduce our emotions or emotional reactions and physical reactions to stress.
I agree. Carla mentioned that you really didn't discuss the crisis of having either no or limited child care for working parents. If you had any strategies in particular that you could suggest to help with that situation.
What I found that, and I know it may be difficult, but to try to set boundaries. When I say set boundaries, meaning putting out a schedule to where you focus either on work, and you should also engage your supervisor into assisting you with your schedule, and also setting aside time when you can focus on one task or focus on just working with your children. Other than that, I believe we're all going through this situation, especially with kids, and I can't give one size fit all when it comes to working with kids as a working parent and as a teacher, especially while they're in school.
Yeah. Do you have any suggestions for someone with a shift, an online workload to 12 to 14 hours in front of a computer with little or no time for relaxing activities? I mean, I think a lot of us could relate to this. I know I can.
You're asking for activities, or what should they do?
For relaxing. So, you know, we get up in the morning, we log into our computers, we work. I don't know about anybody else. I walk up the stairs, and then I start cooking dinner. So we're working these really long hours in front of a computer, and we really don't have time for relaxing activities. Do you have any suggestions for somebody whose workday kind of looks like that?
No, we say relaxing activities. You're saying you may not have time to go to the gym, or you may not have time to complete one of your favorite TV shows.
Or a walk around the block.
A walk around the block. Well, sometimes in being in a situation like that where you work 15 hours, and you may not have that opportunity, I would suggest breaking up your workday, trying to take at least a 5-minute break where you do walk around the block or get outside your cubicle. I'm not certain if y'all have an opportunity to do so, but to take breaks in between your workday, and that doesn't mean 30 minutes to an hour, but taking a 5-minute break to disconnect from your computer, whether it's get up and walk, talk to your coworker, or make a phone call. Do something to break up that 14 hours if you can't get a substantial amount of time outside of work.
Even 5 minutes to walk away is helpful.
Yes, it is. Thank you.
Someone is buying a house during this pandemic. Do you have any suggestions for them how to go about meeting their new neighbors and becoming acquainted with their new town under the quarantine guidance?
I honestly I couldn't answer that, but if it's just, especially in regard to, if you're asking about how to introduce yourself, I mean, we can always go back to a card, to leave a card at the door, or pass out a card, maybe put a card in the mailbox. That could be helpful.
I actually have new neighbors that moved in during this quarantine, and the nice thing is that the weather is good, so people are outside, people are walking, they have their dogs, so, you know, you don't have to be within their 6-foot space. You know, we've been chatting over the fence or while walking dogs while still maintaining social distancing.
Mm-hmm.
Do you have any recommendations for protesters? Is it possible to protest while staying safe?
I'm sorry, I do not have any recommendations in regard to protesting or
Okay.
I'm sorry.
And then the last question we have for you today is, what resources are available for supervisors to help their staff?
Exactly. Some of the things that we're doing now, try to engage them in training, try to provide training and webinars for staff members. Also to create that dialogue and ask about what's going on at home and how best to assist. As we always use, for myself, psychological first aid, we want to address some of the basic needs, and we may not fix the whole sphere. We may be able to chip away at that, meaning I'm not certain whether they have the opportunity to come in maybe an hour late or come in an hour early and leave an hour early. So being flexible with staff members by, one, listening and trying to assist in their basic needs.
Great. Thank you. Thank you very much for all of the great information today. We will be hosting the same webinar in Spanish next week. We also have the grief and losses, both in English and Spanish, coming up next week. You can click on the links on your screen. They will take you directly to the registration pages. Later on, we will be talking about disaster fraud after an emergency. Who are the people in your neighborhood? Community asset mapping is going to be a great webinar being presented by New Jersey Voluntary Organizations Active in Disaster. So basically, knowing what resources you already have. We will have a webinar coming up on vulnerable populations with English as a second language, avoiding scams, where they're targeting small businesses, and providing information and resources for the power-dependent access and functional needs community. So all those webinars are coming up. They are all the links on your screen are clickable. We announce them every Monday. We send out an email, and also we announce all the upcoming webinars in our bulletin. If you haven't already, there's a pod on the top right hand of your screen that asks if you want Region 2 news. So if you want to know about what webinars we have coming up, the best way to do that is to sign up for our email. And this webinar, as well as every webinar that we've hosted in total from January 1 to June 30th, there are 50 webinars, and they can all be found by clicking this link right here. That'll bring you to the FEMA Region 2 page, to the National Preparedness Division. And if you just scroll down a little bit, there will be a link that says Individual and Community Preparedness Webinars. And you'll see not only the webinars that we've done for the past 6 months, but there's an additional 24 or so that we've done from last year and the year before. So to our speaker, I say thank you very much for that valuable information. To all our participants, thank you for joining us today. You're free to drop. Have a beautiful day, everyone.
Thank you.
We good, Allie?
Hold on one second. My computer's freezing. Pedro, can you stop the recording, please?
Mine is also frozen.
Great. I believe the audio has stopped at least.
Yeah, it is.
It's just